So we've been seeing a number of injuries. The most concerning are hypothermia-related injuries, and we have two critically ill patients at this time. We've had one death, unfortunately. We have 5 or 6 that have been admitted for hypothermia, and then we've had a number of people that have been critically ill or just ill enough to be admitted to the hospital from things like car accidents and likely heater-related injuries. We have a lot of tools that we can employ. We break them into two categories. We break them into passive warming and active warming. So passive warming is some of the things you would do at home, just a little bit more intense. That's using warm blankets, warm fluids, and maybe packing heat packs onto people's under their arms or in places where they can get more of their core body heat. And then if they are a bit sicker, if they have more severe hypothermia, then we do active warming, and that can be using invasive measures such as putting in central line and running warm fluids through people. And then there's even more intensive efforts such as ECMO. I would say the first thing about hypothermia that's important is a little bit like chains for your car. The way to use chains for your car is to not ever use them, and the way to get to deal with hypothermia is to not actually get it in the first place. And then I would say the second most important thing is to be aware of when you're starting to get cold. By the time you're shivering, you've already gotten too cold. And so at the first sign of being cold, you really need to get indoors and you need to start getting warm. If you are shivering, you're a little bit behind the 8 ball, and so you need to get inside and get warm. It's also very important to recognize when you need help, and things that people get when they're more severely hypothermic. They get confused, they're shivering uncontrollably, they can have difficulty walking, and so those are times when you really need to call EMS, Medic One, and get them down there to help you and get you to the hospital. I mean, it's cozy to be inside for the holidays, so hopefully people are gonna appreciate that. Certainly driving, unless it's absolutely necessary, is an unnecessary risk. And so not driving and staying inside, those are some of the safest things you can do. If you do have to go out, I think the important things are, the classic dress in layers, avoid unnecessary exposure when you get warm. You don't want to take your jacket off. If you do get wet, that's really an emergency. You need to get dry. You need to get inside. Things like that are critical to if you do have to go out. We have a couple of things that are really setting us up for failure right now. We have COVID, which of course people are trying to stay outside and stay socially distanced. So I think there's some risk there with people having outdoor parties and sitting around. And then unfortunately, all of the people that we have here in Seattle that are living unhoused, they're at great risk. And so we do have warming centers throughout the city that have opened and open every time it gets cold. But I think our hearts are out to those people right now, and hopefully they'll take advantage of those warming centers and not have medical problems related to the cold. It's really important to check up on people. Certainly people that are isolated, today is the day to check up on them, make sure that they have appropriate heat in their house, that they're doing okay, and they have appropriate food and things like that, because it's hard for people to get out. Of course, it's always nice to provide people with a little bit of company during the holidays as well, so that's an added benefit if you check on them. I'd also like to say that anyone with medical problems, you're at greater risk for hypothermia and fall-related injuries, things like that. So those people in particular need to be careful and be aware that they are at risk and have a lower threshold for calling EMS.